And welcome to Nationwide on the network service of the Nigerian Television Authority. I am Habiba Oladipo. Latest figures by the Nigerian Center for Disease Control (NCDC) has revealed rising curve of COVID-19 in Nigeria reaching 7,116 cases, with discharge numbers also improving to 1,907. The number of those who died from the virus stands at 211 as at midnight 21st May 2020. The breakdown indicates that Lagos recorded 139, followed by Kano with 28, and Edo State 25, Katsina 22, Kaduna 18, Jigawa 14, Yobe and Plateau State have 13 cases each. Others are FCT 11, Gombe 8, Ogun 5, Bauchi and Nasarawa got 4 new infections as well, while Delta is having 3, Ondo 2, Rivers and Adamawa have 1 cases each. With the Eid al-Fitr celebration just around the corner and the Ramadan fast coming to an end, President Muhammadu Buhari will be conducting his Eid prayers with his family at home in Abuja. A statement by Garba Shehu, Senior Special Assistant to the President on Media and Publicity, says this is in observance of the lockdown measures in the Federal Capital Territory put in place to save lives and protect people against coronavirus. This is also in line with the directive of the Sultan of Sokoto and President General of the Jama'atul Nasir Islam, Alhaji Sa'ad Abubakar III, suspending Eid congregational prayers across the country, as well as the protocol against mass gatherings issued by the Presidential Task Force on COVID-19. Further to this, the President, who has traditionally shared the joyous moment with top government officials, political leaders, community heads, Muslim and Christian religious leaders, and children, would not be receiving those homages in a bid to stop the coronavirus from further spreading. This year's Ramadan has been characterized with many differences of no feasting in groups and no voluntary congregational prayers called Taraweeh. Despite all of that, in a few hours, it is certain that Eid al-Fitr will be here. But there is an uncertainty about how it will be celebrated. Musbah Udan Wahab tells us more.
The search for a new crescent has begun, and so too is the last-minute shopping for the end of a month-long Ramadan fast, Eid al-Fitr. But Salisu Yusuf is uncertain with preparation for any celebration.
I don't know what you go do because this COVID-19, it don't spoil everything.
Elsewhere, little Muklis Olajire, sizing his new dress, is anxiously waiting for the usual flocking to prayer ground on Salah Day. At least, he had seen a few of such in the past.
Do you like it? Yes. Daddy, are we going for Salah dinner? No, we are not going for Salah dinner. You know there will be no Eid this year, right?
Alas, it is going to be a different mode of Salah celebration this year. That their father has been pressing home to their consciousness.
When they brought their new clothes and everything, they were like, inshallah, we'll be going for it. And the moment I just mentioned the word coronavirus, oh, Daddy will not be going to any gathering.
Coronavirus is novel to this generation, but such pandemic is not new in Islam. And in the series of a new normal, with exception of some northern states whose governors have issued a contrary directive, Muslims in Nigeria, like in many other countries across the world, will have a new experience.
Everybody will pray their Salah, their 2 Rakah prayers in their homes with their family. The Muslims should know that this thing that is happening to us, we are not the only one. This is our own turn to share from the world pandemic challenge which the entire world is facing.
Because there is coronavirus.
It is an incredible reality that Muklis and his older sister, Makfusa, are now very much aware of. But they can only hope for a better future soonest.
I pray that the coronavirus should go maybe like before next month.
In Abuja, Musbah and Wahab, NC News.
Desperate times, they say, requires desperate measures, and these resonate with Muslim worshippers who will celebrate this year's Eid al-Fitr celebration. Although some state governments have relaxed the COVID-19 precautionary restriction measures to enable their citizens attend Eid prayers, guests on Good Morning Nigeria, however, warned to comply with restriction protocols no matter where they observe the Eid prayers. Daniel Aderiye monitored their discussions and now reports.
The COVID-19 pandemic is impacting on every facet of our lives. Beyond the uncertainty of when Muslim worshippers all over the world will observe the feast, how the festival will be celebrated is also in question, and this is on account of the ravaging COVID-19 pandemic. This was the thrust of the conversation on Good Morning Nigeria today, as learned Islamic guests spoke on different perspectives of Eid al-Fitr.
Ramadan, of course, this month that we're in, we use the moon to determine when Ramadan begins. That's the basic weight that we use to determine the beginning of Ramadan, and that's what we use to end it. So the moon is a very, very important issue in the lives of Muslims.
One of the principal sources of what we call Maqasid Sharia, that is the purpose of Sharia in Islam, is to protect life. And that is why collectively the decision taken was that let everybody observe his or her Eid prayer in his house.
The guests also gave insight into the fundamental purpose of Eid al-Fitr and the relevance of the congregational Taraweeh prayers.
If I can allow people to come out twice a day, a week, or 3 days a week, commonsensically permit me, people will ask you, and I'm repeating, are we saying this disease is only there in the house of Allah, where people should be asking Allah to bring a remedy to it?
In this aspect of COVID-19, medical personnel, they are the knowledgeable ones. And Islam ordered us to ask them to tell us. And this is their stand.
While admonishing Muslim worshippers not to lose the essence of the celebration, the guests urged them to use the occasion to pray for God's intervention to end the pandemic. In Abuja, Daniel Aderiye, NT News.
This year's Ramadan has been challenging for the Muslim Ummah, especially with the lockdown and the ban on religious gatherings to contain community transmission of COVID-19. As Muslims in Osun State join their counterparts across the country to celebrate this year's Eid al-Fitr, correspondent Tokwe Alabi in this report takes a look at how the people will be celebrating Salah and the difference in the mood of celebrations.
Few weeks ago, Governor Gboyega Oyetola gave a relaxation order on the lockdown from Monday to Thursday between 6 a.m. and 5 p.m. and total lockdown between Friday and Sunday to contain the spread of coronavirus in the state. From the look of things, it is not likely that the current lockdown as a result of COVID-19 pandemic by government will be relaxed on or before Eid Day.
I, as a person, I will have to celebrate it with my family by observing 2 Rakah.
We have to stay indoor and celebrate it as Allah wish.
Consequently, most Eid praying grounds will be deserted and observance of Eid prayers in congregation just like Jumat services will not be possible.
Going to Eid is nawafil, it is supererogatory. It is not as if it is obligatory. So, which means if we don't go to Eid, there is no harm about that.
Zakat al-Fitr is an age-long tradition observed at the end of every Ramadan fast. With the current situation, how handy will it come this time?
The imam of a particular society or particular community will collect, will gather all this zakat al-fitr and he will distribute it accordingly with the fear of Allah to the less privileged in his mosque.
This praying ground, like many others across the state, will not be put to use during this Salah. But clerics say after giving out zakat al-fitr, it is not forbidden for an individual or families to converge in their homes and observe the 2 Rakat prayers for Eid, excluding khutbah or sermon. In Osogbo, Tokwe Alabi, NTA News.
Many thanks, Stockby. In the meantime, the Corps Marshal, Federal Safety Corps Boboye Oyeyemi, has approved massive deployment of personnel nationwide in order to curb the spread of COVID-19 through vehicular movements as Muslim faithful celebrate Eid al-Fitr. Oyeyemi Ajayi reports that the Corps Marshal emphasized the need for collaborations with other security agencies and COVID-19 task force teams for better level of compliance with the presidential directive on COVID-19.
This is now the regular activities in the Jabi Park. The people here now play, chat, listen to the radio, a new way of spending time as the minutes tick away. In the previous years, this park, like others in the FCT, were busy with vehicular activities during Eid al-Fitr celebrations as passengers traveled to other parts of the country. But this year, however, no activities of such were noticed, as the few vehicles parked seem to have accumulated layers of dust.
No any activities are here for the 30 to 2 months. Nobody is permitted to load. Just no interstate, no vehicle, even at night. You can come here anytime.
In order to ensure strict compliance, the Federal Safety Corps has deployed personnel across the country who are to impose penalties on defaulters. The Corps is also urging commanding officers to collaborate with COVID-19 task force teams and security agencies across the country to ensure maximum compliance with established laws, especially on physical distancing, compulsory use of face masks, and restrictions of movement across states.
You need to still let the passengers know that they have to be active. You have every right to stop that driver before he kills you. And for drivers, we must not place the emphasis on profit above our lives here.
The Corps has commissioned a special patrol team with the mandate of achieving a decline in transmission of the virus amongst commuters, as well as mitigate the attendance risk of road traffic crashes. In Abuja, Oyeyemi Ajayi, NTA News.
And we're not done yet with the preparations for the celebration of Eid al-Fitr as we speak with Dr. Jabir Sani Mehula via telephone. He is the head department of Arabic and Islamic Studies, Sokoto State University. He is also the chief imam, Sultan Saad Abubakar Jumat Mosque, Sokoto. You're welcome to Nationwide and Ramadan Kareem.
Ramadan Kareem, thank you very much.
So this year's celebration will be with a difference, with the shutting down of worship centers. As a scholar, how best do you think Muslim Ummah should celebrate Salah this year?
First of all, I would like to draw the attention of the public that the difference is very slight, is very small difference. For instance, here in Sokoto State, the information we received from the Sultanate Council is that the Eid prayer shall not be performed in Eid praying ground, but we can do in our various mosques for Jumat prayer. So the only thing that is banned is gathering at the Eid praying ground, which is the annual tradition. Secondly, I think we're worshiping Lord, and Lord is alive. So it doesn't matter whether the obedience, whether the practice is as it used to be traditionally, or there is a slight difference. There is an excuse, so there should be a difference. What we shall emphasize on is that we shall have the fear of God wherever we are. We shall also try to abide by the rules and regulation and to be obedient to constituted authorities, because we are not banned from going to Eid prayer just because the authorities do not want us to do that. On the other hand, it is for the benefit of us, it is for the benefit of the public. We shall observe all what is supposed to be observed. For instance, there are etiquettes of Eid that should be observed regardless of whether we're going together at the Eid ground or not, part of which is taking bath in the morning. It is part of Sunnah that on the day of Eid al-Fitr that one shall take bath and also dress in the best way he can. One shall adorn himself. This is part of Sunnah that should hold. Second, we will be chanting Allahu Akbar, Allahu Akbar, Allahu Akbar. It is mentioned in the Quran that once the moon is sighted, once the Ramadan is completed, what is expected of us is to do takbir. So as soon as the Sultan announced the moon sighting, or as soon as the month completes 30 days, if it will complete 30 days, then we will start chanting takbir, Allahu Akbar, La ilaha illallah, Allahu Akbar, Lillahi alhamd, and just should continue till the praying till we eat. Also, we can pray Eid in congregation with our family. If we are banned from going to Eid praying ground, all we can do is to pray the 2 rak'at, that is usual 2 rak'at, as we pray them on Eid ground. So you gather your family and you pray 2 rak'at. The only exemption is that you don't pray, you don't give sermon, the usual sermon that has been given by Imam.
Thank you very much, sir. And just before I let you go, looking at community transmission, what, in your opinion, should be done in curtailing the spread of COVID-19?
Well, it's to follow the advice of the expert, which is to follow the advice of expert, which is maintaining social distancing, also washing hands frequently, and all other advice that are given by the expert. Because Quran asks us to always fas'alu ahla dhikri in kuntum la ta'lamun. That's ask the people of remembrance, the people of expertise, if you don't know. And definitely these are the people of expertise. So I'm calling on all Muslims to abide by the rules and regulation coming from governments and also health authorities to ensure that we stay safe.
Thank you very much. I was speaking with Dr. Jabir Sani Mehula. He is the head department of Arabic and Islamic Studies, Sokoto State University. Thank you very much for sharing your thoughts with us. And moving on, beyond religious and racial differences, the Jewish community under the auspices of Chabi Den has identified with fasting Muslims in Abuja with food palliatives given through the Al-Habibia Society of Nigeria. Abdullahi Ajia has the details of the symbolic handing over of the items to the organization for onward distribution.
Packaged food items which is being donated as palliative by Shabbat Aid Humanitarian Project. The representative of the organization in Nigeria, Israel Uzam, said is born out of the spirit of love and global peace at a time when humanity is in crisis and the less privileged in their need of help.
On behalf of the Jewish people from the Jewish religion, Jewish community, and this is what we try to do here in Nigeria. We open an office and we try to understand the real need and the development that we can bring it here. And Chabad Head, we try to assist this. And during the Ramadan,
the Al-Habibia Society, known for its organized structure for humanitarian services, who will serve as a channel to reach out to beneficiaries, appreciates the gesture with a promise for fair distribution of the items.
Nigerian, on behalf of the Muslims, on behalf of Al-Habibia, we are grateful to the Jewish community, we are grateful to the rabbi who is passionate about working with Al-Habibia, about working with the Muslims.
Inshallah, we're going to do justice from now. At this moment, we will do symbolic because of social distance rule, protocol. We try not to overcrowd this place.
We don't have anything to give now back as the way you give us. May Allah subhanahu wa ta'ala bless all of you.
This is the first time the Jewish community in Nigeria is reaching out with such support, which its representative said will be sustained beyond this package for 1,000 family. Abdullahi Ajia, NTA News.
Join Hinginu in our Lagos Center for more reports on Nationwide.
Thank you, Habiba. As community transmission of COVID-19 spikes in Nigeria, there is an improvement in the willingness of residents in Lagos State to comply with the directive of government to use face masks in public places to protect themselves and others from the virus. Nosa Usla, who sampled the views of the people, reports that the use of the mask has stepped out of being a government directive to a way of life and a lifeline.
The Nigeria Center for Disease Control and other international health organizations have explained that while social distancing and good hand hygiene are the most important methods to prevent virus transmission, new guidelines state that healthy individuals should wear masks in public settings, particularly when physical distancing is difficult. Residents are of the opinion that nobody should wait to be forced to wear a face mask, especially now that community transmission of the disease is rife.
I have to cover my nose, as you can see what I'm wearing, so that I will protect myself entirely from the coronavirus.
It's quick to make face mask, and I had the piece at home, and since I can sew, I just quickly made this.
This one is not something that's just like ordinary that you can throw around another. So this one is well packaged, and I've been using it for some time, even before the coronavirus.
The one I'm using is old. I want to go and buy another one here.
Lagos State Governor Babajide Sanwo-Olu had made the wearing of masks mandatory in a bid to halt the spread of COVID-19 in the state.
Anytime you're in a public place, please ensure that you're wearing a face mask. It is not only to protect yourself, it's also to protect you from others.
According to the Lagos State Commissioner for Health, Professor Akin Abayomi, primary benefits of wearing a mask include limiting the spread of the virus from someone who knows or does not know they have an infection to others.
There are no medical disadvantages. As long as your mask is not too thick and is stopping you from breathing, you should be okay.
The commissioner added that the use of face masks in public places is non-negotiable to limit the spread of the virus until the scourge blows over. In Lagos, Nosa Osula.
From the poorest child who now has access to nutritional meals to parents and vendors, the homegrown school feeding program is changing lives. Now, with the coronavirus pandemic posing greater challenges to livelihood, one can imagine the excitement of parents with pupils in primary schools in Lagos. Michael Olale reports.
This new approach to the National Homegrown School Feeding Program is targeting households with children in public primary schools. It is an innovation caused by the coronavirus pandemic, but the benefits and excitement it is giving to households have overshadowed the uncertainty induced by the virus. Yinka is one of the living casualties of COVID-19. She lost her job during the pandemic, and at a time survival seems dimmer, the federal government came with a rescue package.
Because to it don't hard for me. I beg government, you do well, to do well for all of us.
42-year-old Salami Gambo, a mother of 4, knows the meaning of poverty. 3 square meals per day is by chance, but the next 4 weeks is likely to be best courtesy of the palliative.
This thing will help me well for my house. I have children. I no work for me, so I can manage the one way I sit.
The gains derivable from this program is not limited to the parents and their children, but vendors like Happiness is gainfully employed and contributing a quota to educational growth.
There are some children then decided not to write. Even when the teacher is teaching, they don't want to learn. But because they see that learn have come, you will see then they begin to pick up. If some parents will say the truth, they will say they have improvement in their children's life.
The Lagos State government said the program has increased enrollment, hence its sustenance.
That is going to be given to them on a monthly basis, and we hope and pray that the school resume very soon, and if school resume, we will do the normal, school feeding program we have been doing before.
At this particular center at Koshofe, more than 114 households have benefited, with 37,000 households expected to be covered during the partial lockdown. In Lagos, Michael Olale, NT News.
That's it from Lagos. We now take a short break. Nationwide continues after that.
Glad to have you back with us. Researchers in Nigeria are looking inwards and coming up with innovations that will help flatten the curve against the novel coronavirus. Tina Toro reports that the National Research Institute for Chemical Technology, Zaria, has come up with a range of products using advanced technology for the prevention and control of the virus.
The fight against COVID-19 is work in progress globally, as medical experts assert that there is still no known cure for it. Emphasis, therefore, is on prevention and control. It is against this backdrop that the National Research Institute for Chemical Technology, Zaria, came up with a number of products to help Nigerians stay safe and free from the virus.
The product we're producing will target the morphology. What it is doing is to remove the protein layer and expose the RNA. Once that is exposed, it is finished because it will not, the environment will work against it.
The use of nanoscience and nanotechnology with nanosilver particles as key ingredients in the formulation of these products, the researchers say has made the first line of defense against the virus possible.
And it's a very reliable and acceptable field of study. However, in Nigeria, the development of nanotechnology is still at the infant stage.
The technology is domiciled in Narit here, and we use available local raw material for the formulation of both alcohol-based hand sanitizer and silver bell hand sanitizer.
The institute is also working towards producing virus-resistant fabrics for face masks as well as nano coating or spray to combat the virus. In Zaria, Tina Turu, NTA News.
The world is rife with evidence that the coronavirus pandemic has given nature a little respite to rejuvenate and breathe by forcing man to stay indoors. Coming back out to therefore requires that humans learn to cohabit the earth with other creatures to sustain the delicate balance of nature. This sums up the thrust of the World Biodiversity Day celebrated this year with the theme, Our Solution is in Nature. Onege Fineface reports.
Resting under the shade of a tree is soothing and comforting, and that is because the tree provides a shade against the elements of nature. Now, having development alongside conservation of nature is what World Biodiversity Day seeks to achieve, a sense of conservative consumption of nature.
Insects like bees, mammals like bats, and primates like monkeys and squirrels, they carry out pollination for us without us paying them. If you do not have nature, our very survival is threatened.
COVID-19 induced lockdown across the world taught humanity that a healthy environment is possible. Wildlife, long unseen, appeared in the most unexpected of places, reminding man that they too are part of the earth and have the right to exist.
Most of the oxygen we consume as humans is produced by these trees in this forest. If we destroy the forest, we are starving ourselves of oxygen. We'll be killing ourselves.
Studies from the United Nations indicate that around 60% of all infectious diseases in humans and 75% of all emerging infectious diseases are zoonotic. That is, they get to humans through animals.
There's a link between COVID and wild animals. And when you destroy the habitat of a given species, in the process of handling that species, there could be transfer of one virus or the other to the human.
The theme for 2020 is Our Solutions Are in Nature, and this applies also to COVID-19. A healthy ecosystem provides water, food, medicines, clothes, fuel, shelter, and energy for humanity. All reasons for mankind to protect biological diversity. In Abuja, Onenge Fineface, NTA News.
The rising statistics of infected healthline front workers in the fight against COVID-19 in the country continues to engage critical stakeholders, discussing parameters that will guarantee a stable and improved working condition, as well as welfare packages to sustain commitment. Abubakar Usman Akwanga reports that this is coming as more than 150 frontline health workers are reportedly exposed to the coronavirus across the country.
As a form of solidarity to their colleagues at the front lines in the fight against COVID-19, these health workers here are to provide professional and financial support to those giving their all to save others. They are engaging public-spirited individuals and organizations to raise 2.5 billion naira for the provision of medical hardware and insurance package for COVID-19 healthcare frontliners.
Our target here and what we have done here today is to scout around who are the people that are ready to support or who have been supporting the frontline health workers.
Traditional religious leaders, among other stakeholders, laud the initiative.
We will make a pressure
to see that we make necessary arrangements to meet those who are going to assist.
Frontline health workers, if you look at the advanced world, they have been given due attention and they have been given the support needed. And this is the first time you see NMA, the Paramedical Society of Nigeria, and so on and so forth, they come together.
The equipment purchased from the proposed funds will be recalibrated in meeting future health challenges in the country. In Abuja, Abubakar Usman Akwanga, NTA News.
Committed to improving the living condition of women and children in society, the Sir Optimist International Asokoro Club has donated delivery beds and air conditioner to the maternity ward of the Kuje General Hospital, Abuja. Asabe Tanimo Williams has a report.
Women and children are vulnerable when it comes to health issues. Hence, proper attention is needed in this regard. These were the words of the president of Optimist International Asokoro Club, Victoria Pila, when the club donated hospital equipment, one of which is a delivery bed and 1 horsepower air conditioner to Kuje General Hospital.
Without light, without electricity, the air conditioner will be useless, and some other equipment in the hospital and in the maternity will be useless. And so we are calling on government to try, in whichever ramification it can, to increase and improve our power supply.
You don't need to get plenty money. Any little way you get, whether money or food, anything way you get, show that little kindness to your neighbor.
No matter what you achieve, if you are unable to affect the lives of people, then you have not started.
Receiving the donation on behalf of Kuje General Hospital, Chief Medical Director Oscar Udofia appreciated the gesture by the club for deeming it fit to visit them at this time the country is fighting a deadly disease.
Your donation of 2 delivery beds is very, very welcome, and it's just coming at the right time.
With the pandemic lockdown, the men have been at home for weeks, so there will be a lot of deliveries after this COVID-19. So it's a very good thing they brought for us. We appreciate them.
Sir Optimist International Asokoro Club is a non-governmental organization made up of women who voluntarily offer humanitarian services to women and the girl child in their local communities. Asabe Tanimo Williams, NTA News.
And let's go to Ibadan, where Kemi is our guide on Nationwide.
You Abiba, and welcome to Ibadan. Worried by the rising figures of COVID-19 in Oyo State, the need to contain its community transmission, the National Orientation Agency has continued its sensitization and advocacy visits to some major areas in Ibadan, the state capital. Omokende Igbari reports that the National Association of Women Journalists, NAWJ, is partnering in this.
Of the National Orientation Agency was the major market in Ibadan. The state director of the agency, Mrs. Dolakwa Dosumu, who noticed the measure of compliance to some preventive regulations on COVID-19, stressed the need for further improvements.
Send a distance from contacting the next person to you. It's not difficult. This responsibility is on us as citizens to obey this simple regulation.
Ayeye Market, Agodi, Ibadan North Market, and Mokola Roundabout, all in Ibadan. Compliance of persons and riders was low.
Washing our hands before we enter our house, we use our sanitizers. Then when we want to talk to somebody that is a stranger, you cover your nose. You maintain distance.
Every day I'm watching my nose cover. Prepare. Only one person like here to October 1, 200. There are some that they'll just buy it. I was telling them that wash before using. Some day they'll just buy it and put it on.
Meanwhile, the National Association of Women Journalists, NAWJ, Oyo State, were at the NOAA Directorate on the need for more women to key into its think tank platform for more awareness in Ibadan. Omokende Igbari, NTA News.
As global efforts to mitigate the spread of coronavirus continue unabated, another group of vulnerable persons that must be considered are the physically challenged. In this special report, Ifeoluwa Moshule x-rays the challenges of persons with disability during coronavirus pandemic.
The novel coronavirus, which was declared by the World Health Organization as a pandemic in March 2020, due to the speed of transmission, has claimed millions of lives across the globe. as scientists all over the world are working round the clock to find a cure to the coronavirus. Some set of people have been identified as vulnerable. How are the physically challenged coping?
I find it difficult to go out because I have to go out with somebody that we need to lead me.
To get information, but most broadcast news are not done with sign language. It gives a lot of problem.
Experts, however, call for special attention to people living with disabilities in the ongoing war against the pandemic.
Emphasis here is that they must be trained, they must be educated. If you like, you call it health education, their own health education. Let them understand their peculiarities. Let them understand if they have underlying health factors, what to do.
Inability to capture the dissemination of information by the people with sight and hearing disabilities may water down all efforts at combating the disease. In Ibadan, Ifeolu Omoshile, NTA News.
As Muslim Ummah ends the month of Ramadan, the coronavirus pandemic has brought about a unique way of celebration this year. Dayo Gushola is at the popular Eid ground in Ibadan for a situation report on the mode of preparation.
On a day like this, clearing of this environment will have reached an advanced stage in preparation for the Eid al-Fitr celebration. But as it is, this place has been outgrown with weeds. And of course, the place is under lock and key, indicating that there will not be gathering of worshippers here when eventually the moon for the month of Shawwal is sighted, terminating the 29 or possible 30 days of fasting among Muslim communities. The situation is a reflection of ban on public gathering, including religious gathering. This is to contain further spread of coronavirus pandemic spreading across the world. Of course, recently, the special advisor to Oyo State Governor on Media, Mr. Jide Ajani, has to issue a public statement to debunk rumors circulating on social media that the Oyo State government has lifted ban on religious gathering. As it is, we are going to keep you posted as the situation unfolds. Back to you in the studio.
Thank you, Dayo. And that's it from Ibadan. Habiba, it's back to you.
Many thanks, Kemi. The federal government has declared Monday 25th and Tuesday 26th May 2020 as public holidays to mark this year's Eid al-Fitr celebration. The Minister of Interior, Ogbeni Rauf Aregbesola, who made the declaration on behalf of the federal government, congratulated all Muslim faithful for the successful completion of the Ramadan fast. Aregbesola, who called on them to replicate the life of kindness, love, tolerance, peace and good neighborliness as exemplified by the Holy Prophet Muhammad, peace be upon him. And Sokoto is our next stop, where Abdurrahman is standing by on Nationwide.
Hello, Habiba, and welcome to Sokoto. With the ban on performing Eid prayer at the central Eid ground and other festivities in the state, security operatives in Sokoto say the law must be obeyed. Sheikh Muhammad Datti tells us more on the security arrangements and other Eid al-Fitr preparations amid the COVID-19 pandemic.
Unlike other states where Eid al-Fitr prayer will not be conducted, in Sokoto State, the Eid al-prayer will be conducted in Jumat mosques across the districts and villages.
The Hanni is the central Eid praying ground here in Sokoto State. In the previous years, at a time like this, the place would have been wearing a new look, ranging from painting and other decorations preparatory to the central Eid prayer. This year, due to the ban on the central Eid praying here, nothing is going on.
The idea is to reduce the convergence of people at the central Eid praying ground due to the COVID-19 pandemic.
We are always ready and prepared to ensure that the festivities will be carried out without much problem as far as transportation is concerned.
We are equally soliciting further for more cooperation from the members of the public in terms of sharing of useful information and intelligence that will always lead to the boosting of the security status of Sokoto State.
We should continue to respect all security agencies operating in the state. Whatever we do is in their own interest.
At the perishable market, buyers decry over hike in the price of the items. Investigation conducted by NTN News reveals that the hike is due to low supply of the commodity because of the restriction of movement due to coronavirus. A visit to the animals market shows that the market was at its peak with buyers. The Eid al-Fitr is a period where people come together in groups, contribute money to buy bulls, and share the meat to be used for the festivities. In Sokoto, Sheikh Muhammad Datti, NTN News.
The Joint Technical Task Team on Emergency Response to COVID-19 has commended compliance to presidential directives on free movement of agricultural inputs. This is as the team in Sokoto continues its assessment visit to the state boundaries to ensure unhindered movement of the produce. Dalhatu Abdullahi completes the report.
The team, led by the Assistant Commissioner of Police, Hayat Anjuma, who represented the chairman of the committee, and State Commissioner of Police, Ibrahim Sanika Oje, was at Sokoto Kebbi boundary to assess and facilitate the movement of the produce. The team, however, expressed concern on the attitude of some transporters who ferry passengers in their trucks, which could compromise the security and health of the nation.
One thing that we are going to do, what we must maintain, is that any vehicle that is carrying goods, verify. Is it the real agricultural products carrying in and out? That is one. Two, they should not carry passengers.
For now, they're supposed to, advise people to stay in their states.
The team is working with other relevant agencies in states and local government areas to develop a window that will facilitate the free and unhindered movement of the produce. In Sokoto, Dalhatu Abdullahi, NTA News.
That's it. Back to Habiba in Abuja for continuation of Nationwide.
Many thanks, Abdurrahman. Gombe State Government has commenced the distribution of food materials to households across the 11 local government areas of the state to cushion the impact of the restrictions put in place to prevent the spread of the coronavirus pandemic. Correspondent Emmanuel Akila reports that the distribution is flagged off in Bo, Shogom local government area of the state.
The palliatives include rice, spaghetti, maize, sugar, cooking oil and other foodstuff, which would be required by the people as they obey the restriction orders of staying at home due to the ban on movement and the closure of some businesses. To effectively reach the vulnerable and the poor, the state government inaugurated a committee chaired by the Emir of Gombe, Alhaji Abubakar Shehu Abubakar III. Gombe State Governor, represented by his deputy, urged the people to be patient and be their brother's keeper while the battle against the COVID-19 pandemic is intensified.
It's a pandemic that has crippled economic activities virtually everywhere. And being a concerned government, we thought it is only right and proper to come to the aid of people, having dislodged them from their economic activities that they were used to.
The beneficiaries appreciate the gesture, praying for an end to the COVID-19 pandemic.
Ya bani abin da zai ci ma da marayu da nake da su. Na gode mishi.
Na gode. Dama muna cikin wahala ya ji mu sami sauki. Mun gode Allah.
The Palliatives Committee has come up with a plan to reach out to 30 households in each of the 2,218 polling units in the 11 local government areas of the state. In Gombe, Emmanuel Akila, NTA News.
Obehi is in Benin, standing by with more reports for Nationwide.
Hello, Abiba. Welcome to Benin. Edo State government has received donations worth 154.5 million naira meant for COVID-19 palliatives, courtesy of the Victim Support Fund, which is a collaboration between the federal government and the private sector. Goodluck Enani reports that 70% of the donation is from the federal government.
The demands of the doctors range from the clearing of all backlogs of arrears, the payment of March and April salaries of 20 of their members, as well as ensuring regular payment of their salaries.
Chairperson of the COVID-19 Victim Support Fund, Toyosi Akrele Ogunsuji, says
They commenced their assistance from Edo as it currently has the highest cases in the South-South.
The cumulative monetary value of our expense and donation to Edo State is to the tune of 154.5 million, and that covers food, that covers personal protective equipment to healthcare workers in 500 healthcare centers.
Governor Obaseki is happy with the fund's humanitarian assistance across the country. He described the donation as timely as it will help greatly. He says his administration adopted data-driven contact tracing, massive screening and testing approaches targeting 500,000, adding that the donation of the personal protective equipment is timely.
Across all the local governments, we were able to pull in resources, medical resources from our state hospitals, our local government primary healthcare centers.
Wife of the governor, Bessie Obaseki, received the items at the warehouse with an assurance to the team that they will get to the target beneficiaries. The VSF team visited inmates at the IDP camp at Abuja and presented food items. In Benin, good luck in any NT News.
Resident doctors at the University of Medical Sciences, UNIMED, Ondo State, have attributed the suspension of their planned strike over unpaid salary arrears to the compassion for patients, especially during this coronavirus pandemic. Tony Battery reports.
The demands of the doctors range from the clearing of all backlogs of arrears, the payment of March and April salaries of 20 of their members, as well as ensuring regular payment of their salaries by taking it to the central pay system for the convenience of the doctors.
What we are asking for is legitimate. We are not asking for too much. This demand is sacrosanct. Upon this resolution, we stand.
Dr. Taiwo Olagbe noted that up till now, the demands have not been met, but the association just shelved the strike so as to give ample time for the association and the government to fine-tune things. Speaking on the development, Ondo State Commissioner for Health, Dr. Wahab Adegbero, said the state government is making arrangements to meet their demands.
We are paid up to April, the resident doctors. So there are still some other issues that are also being resolved.
Resident doctors, however, say the strike is only suspended and not called off. In Akure, Tony Batire, NT News.
And that's it from Benin. Please stay tuned for more reports on Nationwide after this break.